The main variations we found were remarkably variations in incidences of major amputations for PAD or diabetic foot syndrome between countries in New Zealand, for instance, with the lowest incidences, and countries like Hungary or Slovakia with the highest incidences per 100,000 inhabitants. It's hard to tell given the data we collected. It's merely speculative right now. We compared the absolute numbers and incidences per 100,000 inhabitants and used other observations such as incidence of diabetes or important comorbidities or data from the OECD like life expectancy, gross domestic product or healthcare expenditures. But we can only generate hypotheses, but no, we cannot prove what are the underlying reasons. One possible explanation might be that in countries like Hungary or Slovakia, the healthcare expenditures, especially for vascular maintenance, are lower than in countries with low major amputation rates. Usually I would say yes. It would surprise me when I read the data for the first time, but our colleagues from Hungary had the feeling and the main idea already in 2012 when they raised concerns about differences in treatment practice patterns all over Europe. So we had the hypothesis that there are differences, worse outcomes in Hungary or different patient selection in Hungary that was confirmed by this study. So it's not really surprising. The main message of this study is that we want to expose a problem in Hungary and a problem with vascular maintenance, and politics and vascular physicians should work together to find the underlying reasons for these remarkable variations in major amputation rates and work on possible solutions to improve the situation for patients living in Hungary and other Eastern European countries.